Good evening, Pahrump. I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, and this is the regularly scheduled show. I know Ray last time said that that's a real problem because they probably, hopefully, will put the rerun on the beginning of the show just in case I don't make it. But this is the live show. There is the call-in number there, 727-8750, for those of you who are waiting to see if this is a rerun or not. But that brought up an interesting topic because one of the things that people are not aware of is that you can actually see some of the rebroadcasted segments. I don't know how they categorize them, but if you go to the YouTube KPVM 41 site, type in Independent Doctors of Pahrump, you can watch the old segments. There are some that are on there, and I think they run the 15-minute segments in between the commercials and things of that nature, so that those of you who are interested in don't have a channel, don't have KPVM 41, if you call the channel, I believe they'll come out and put an antenna. If you have cable, I think it's on a different cable 12, but all you have to do is call and the station, and they'll actually come out and put a free antenna on for you, I believe, but I'm hoping it's free. So usually we get some call-ins to kind of spark the topics of conversation, but one of the things that came up in the office today is one of the explanations that I sometimes do. Ray, are you here?
Yeah, I'm here. I don't know if you can hear me. It's a little staticky on the phone.
I can, very well.
All right. Hey, you know, there's something going around, Doc. I mean, the judge was sick last week. I was sick for 15 days with a severe cold. I was almost going to go to the hospital. I think I had bronchitis. Then I listened to a radio show, and the anchor on that show said that he had this bronchitis, and he took antibiotics, and he's okay. Now, it's been 2 weeks since I had any problem, and it's coming back. Do you think this is something I should really be concerned about, or is it possible I just got another cold with a different type of virus or whatever? You know, it kind of concerns me because when I get a cold, it's 62 hours and it's over with, and I had one for 15 days, and it was really pathetic. So if you can give me some consultation on the TV, and maybe I'll call later, but I just concerned about what's going on in the Valley. A lot of people are really sick right now. They're coughing in the courtrooms. They're sneezing. It's pathetic what's going on.
Yep.
So I'll hang up and let somebody else call in, but let me know what to do. All
okay,
right.
Well, obviously without listening to your lungs or hearing what's going on, it is not that uncommon that you could not get another illness while you currently are infected or in the recuperating phase of something else. Usually upper respiratory infection, colds, or most of these are viral. They don't usually summate, meaning usually you don't get one, and then while you currently have one, you have another. And probably the main reason for that, and I don't know this for sure, is that because of mucus congestion, because of all the things going on in the rhinorrhea and the mucus that's flowing and the irritation, you can't usually get another virus because, at least in the upper respiratory, because the mucosal membranes are the attachment point for the virus. And they're so irritated, so inflamed, that the virus has to actually attach to receptors on the particular cells and actually go inside the cells and then start to do their nasty thing where they replicate and inflame tissues, and then that starts the immune response to actually wake up our immune system to rid ourselves of the particular virus. Because if we didn't have that, then we would never be able to get rid of any infection, bacterial or whatever. And bacterial infections, sometimes what people will do, they'll say it's a cold, I'll wait it out 3 or 4 days, 5 days, and then it's not seeming to go away, so they'll go into the doctor and get a prescription for antibiotics, and then all of a whole, they're better. Well, it might be that you are going to get better anyway in most of those viral infections. And like I've always said, usually if you have some predisposition to a bacterial infection, such as COPD or some other debilitating illness where your immune system isn't working very well, or in your lungs you have scar tissue and mucus plugging where you allow bacteria to grow, then you're likely to get maybe a secondary bronchitis or a mucopurulent a cough. And remember that if it's yellow and you're coughing it up and you have running a fever, then it might be bacterial. If you're having a green mucoid-looking discharge, grayish, brown, green, then it's probably not bacterial. It's probably more viral, and certainly with a low-grade fever. But the minute it turns yellow, then that certainly could be a bacterial infection. And as you get older and your lungs really don't aerate very well, mucus plugging can sometimes set up what we call an anaerobic condition. Most bacteria do not grow well in oxygenated environments. They tend to grow better in low oxygen environments just because of the way they're set up. And oxygen usually destroys bacteria, so a good aerated lung will help to delay or retard the bacterial infection. So let's take a viral infection. You got a viral infection, you're getting mucus production, and you don't really have a good cough, or you don't have a good mucus clearing mechanism, and then what happens is a mucus plug develops. The bacteria that normally live there don't really have a chance to grow because they have a high oxygen environment. Your lungs are keeping open. All of a sudden now they're closing up. They can't open up very well, and the bacteria start to grow. That might develop a pneumonia. And really about 1 out of every 10 upper respiratory infections can develop a pneumonia. It's a cascading event, meaning A has to happen, B has to happen, C, and then you'll develop a pneumonia. If it wasn't easy, if it wasn't hard to develop that, then almost everybody who got a cold would get a pneumonia, and that usually doesn't happen. So that's the process by where you get this confusing symptoms. So, and there are some people that just get a walk-in pneumonia. They call it walk-in pneumonia. They come into the doctor's office, they cough, they got a fever, and they didn't have an upper respiratory infection. And how did that happen? Probably the most common cause is the idea that they can aspirate. A lot of people lay recumbent at night. They eat late before they go to bed. And that will produce reflux, which acid becomes very irritating. In fact, it's one of the causes for COPD. You can be a non-smoker and have chronic gastric reflux, and that chronic irritation and acid can cause scarring in the airway, because chronic obstructive pulmonary disease is an obstruction that is chronic, and it takes irritation and scarring to form that. And you can scar your lungs through smoking and chronic bronchitis, or you can scar it through noxious substances. And acid from our stomach is a very noxious substance. It can cause scarring. So it is one of the listed causes of chronic obstructive pulmonary disease. And so this is basically the setup for chronic bronchitis, where you don't aerate your lungs, you get bacterial infections, and those kind of people who wake up with that can close off their airway. In fact, if you do a chest x-ray on some people that for whatever reason can't open up their lungs, they'll have a term called atelectasis. And atelectasis is a closing off on the airway. It's kind of a collapse of the airway, and that's usually the first stages that one can see in developing or helping to set up this pneumonia. Atelectasis can cause high-grade fever or low-grade fevers at night. If you don't open up your lungs at night from asthma or some other condition, you can basically get a low-grade fever. So I think it's common for you to get sometimes secondary infections, and what's going around in town, who knows what this is. I think we get a resurgence of a diphtheria-like illness that can last 2 weeks. I think there was happened that's as adults wax and wane in their immunity to diphtheria and pertussis. Those things can come back, mainly pertussis. Diphtheria is a different issue altogether, but whooping cough. In adults, it's much different. And as we get older, we have a hard time fighting these things off, so it takes longer for us to get them. I remember I had similar to what you're talking about, Ray, a couple of years ago, and it lasted for almost, I would say, 3 weeks. So we're going to go to break, and then when we come back, any other callers, and we'll pick up this subject when we come back. Thanks for tuning in. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.